everyone. Welcome to my show, NainaMD, Beverly Hills, Fusion of Science and Beauty. And I've got an amazing guest. He's appeared before, and he will appear in a lot more shows. Get used to Dr. Jason Emer. He's a leading dermatologist in Beverly Hills. And today, I think it's so important we talk about facial rejuvenation because there's like it's all over the place. You've got every med spa, you've got every hair clinic, every nail salon involved in a Botox, or you've got a filler or whatever. And we want to present, and I think you understand this, is really there's much more detail than just a Botox and filler approach to facial rejuvenation. There's new ways, and there's just ways and synergistic ways that you can do things. So will you share with us just like how you just even approach facial rejuvenation and why you may not want to go down to the next salon or the grocery store, and why it is important, even if it's just and we're not that, it's not that much more. It's really when you look at the result and the long lasting part of the result and the technique and the potential avoidance of complications, it's much better to come to a place where you have this kind of an approach. So that's what I want the audience to see.
They need to look at you and say, okay, you're at this age, we want to enhance these features. How do we do that with the limited complications, with the best results, with a natural appearance where no one else would know?
Yeah.
And that separates, that's someone like you or me who's doing this every day, who lectures on it, who does newer techniques, like I do something called cannula injections, where instead of using a needle, I'm using a blunt instrument into the skin to put the filler so there's no bruising, swelling, or pain.
Right.
Whereas you see people leaving and they get these needle injections.
Or needle injections, or how many times have you seen, okay, how many women have you seen, they'll come in and you'll say, okay, I just want to know, I want only this many units, and that's all they're focused on, and what's the best price you can give me for this many units? It doesn't work that way, because they're avoiding, well, maybe I didn't want to give you this, but you could have gotten a little bit of volume, and that would just take away your entire aging of the face.
Right. And
so,
that's where I think the philosophy and the brand comes
and education.
in. Right. So that when the person comes in, they know you're this expert, they respect it, and they'll listen to the things that you have to say, and you're talking about the education. Someone may come in and be focused on this forehead wrinkle, but if you gave them Botox, maybe their eyebrows would come down, and they wouldn't be able to see because the lids would go over. Or maybe they really do need lifting and volume rather than they need wrinkle reduction. And so I really think, you know, a proper assessment with somebody that understands the anatomy, understands the complex condition that is aging, and you know it's both external and internal. And so volume in the face, you know, I have a lot of people here that are getting, you know, these new fillers that are supposed to last 2 years, but they're on an LA diet, they exercise every day, they're on...
And do you know fillers, as you know, we love the hyaluronic acid because it's natural, but there are some fillers that can cause inflammation. So if you already have a person who's predisposed, you're not going to choose that. You're going to choose the one with the hyaluronic acid. But if they just go to a regular place where it's like, okay, where can I get the best price for what?
Right, they may just give what they have. Sometimes they're doing things that are what I see in my practice. We do a lot of complication. We fix a lot of people's botched jobs, is that they're doing fillers that aren't even approved or bought from other countries or brought in.
Oh, I know.
And so that's why an established, you know, well-trained person is super essential. And then what you were going back to about the complexity of aging and rejuvenation, it's not just a single treatment. You need combinations. Combinations are what are going to give you the most natural appearance and exactly the best result. And that includes, you know, Botox for relaxation of wrinkles, fillers for loss of volume, radiofrequency tightening procedures, and ultrasound for lifting, and also lasers and other radiofrequency devices for redness, for pore reduction. So,
you know, one of the things we both, because we're so alike in so many ways, we both bought the same machine without even like each other knowing it. So it's a Venus Freeze, it causes multipolar radiofrequency, which, you know, by creating this, you get this heating, that even multidimensional arc that actually allows for even heating to promote tightening. But it also has this pulse electromagnetic field technology, which no one has ever heard about, that promotes like the angiogenesis, like growth factors and new vessel formation. But long story short, the point I'm trying to make is, it's again a synergistic, right? Where would you find, sometimes you may come across, like what you said earlier, it really hit home. You have a patient who says, I just want Botox in my forehead. I want every line of my forehead gone. Well, wait a minute. If you want every line of your forehead gone, you've got a small forehead, your eyes are going to droop.
Exactly.
And then what are you going to do? Then you lost a beautiful natural eyebrow thing.
And that's now the disproportion and the unbalanced appearance. And that's why I say...
And how many females have we seen
right,
and
in
males
LA,
that have
out
in
here.
LA that have disproportion because no one is paying attention to this.
And a lot of it's because people are templated. You know, they see a filler, they think cheeks out here. They see a line, they think fill. They're not looking at the three-dimensional, what happens as people age, where mid-face starts to fall and the bone starts to resorb and the eyebrows start to come down. You know, and it's not only about a wrinkle, it's about rejuvenating the skin, making the skin have more elasticity, building its collagen, making, like you said, the blood vessels more healthy. And by doing that, that requires more treatments, somebody that's more trained, that really understands the technologies, like you were saying. If you're just buying a machine, you just have a device, you're just using a filler or something, you're not going to have that combination, that really astute knowledge, you know, that I think is important for aging.
And you know what I think, which I love about you, is we are busy. It's not like we don't lecture. It's not like we don't have patients waiting for us. But we do a lot of our treatures. Whether it's working late in the night, I do so many of the treatments. I don't just give it to a tech or a nurse. There's a place, please don't get me wrong, I have amazing staff to support me, but this is such a serious issue for both of us that it is so important that I think if you have a device and you've got a gadget, you need to know how to work it. The doctor needs to do it.
I agree.
Don't
and I
you
think that, especially when you're not doing just a menu of options, you're creating a long-term plan for somebody. It's very important that you understand and you do, and not delegate it out directly. Not everything.
You learn to know about their consistency. You might have them come in for a touch-up or something once you get to know them, but someone that you're just getting to know, you need to do a couple of treatments to get their feel, what their body, what their face feels like.
Exactly.
I was like last night, I was there here till 9:30.
You know, if you were to follow a template in filling the cheeks, you would make a male look more female.
More female, and there's so many I've seen that, and you know, again, I've seen also when my mentors that first taught me, which were a long time ago, but they were the traditional, they said just a male forehead, you need like tons of Botox and everything right in the forehead. Excuse me, not our male patients. And especially, again, I think there's a very, very strong, a significant, the gay community needs to be heard. They need to know that their vision for what a male looks like is different. And even a conventional male is saying, I don't want to look like I'm estrogenized. As you know, as males get older, they build up estrogen, right? So we don't want to be like estrogenized here and then be looking like turning into basically like a female.
I mean, an interesting thing that you see often in people that aren't really as astute when it comes to the male face is, you know, over Botox in the forehead not only brings down the line or makes the eyebrows look lower, it also atrophies the temple muscles. And so somebody now has no wrinkles, but now they have temple hollowing, what makes them look older, you know. Or you Botox the crow's feet, you know, for the wrinkles out there, and then you get a little bunching under here. And there's all these consequences that if you don't understand the combinations or you do it properly, that you're really changing someone's appearance. And that is the old mentality, in my opinion, of people who do cosmetics about a procedure-based practice. Someone comes in, I just want Botox, this is what I'm going to pay. When someone comes in, it's a philosophy-based practice. It's we're gonna come up what your goals are and create a long-term plan. Short baby steps to get to that, and keeping you looking natural at that age as we age, because aging is never going to stop. It's always going to progress. Can we reverse it a little bit? It can, but we can't bring it back to what it was before completely. But we can only do that in somewhat of a natural, by doing little things, we can do it in somewhat of a natural appearance. And so that is, I think, the most important things. But the patients that are looking for those deals are really the ones that are going to find themselves in a place that isn't best for them. You know. And
then don't think that you get to a certain point that they're going to just say, okay, I think I just need to go and get my facelift done, because we just heard Dr. Mark Berman. I had him come on a show, and he said that's the first thing that as plastic surgeons we do. We can't just tighten, we can't just lift, because still not looking at the 3D and
Right.
restoring the
And
volume.
that's where in the past people were lifting, but they didn't realize they needed volume.
Yes.
And so it's really a complex process of volume and laxity in terms of wrinkling, as well as texture and tone, color. There's a lot of things that are involved, and it's not just one thing that's going to make
And
it
you
look
need to
good.
have
It's a
centers that
combination.
be able to have combination, have the latest greatest technology,
Right.
be able to have access, and be able to afford the machines. My God, every
Right.
time I thought lasers were supposed to go down in price. They
No,
keep
they keep
going
going
up.
up.
They
They
go
keep
up and
going
up,
up.
don't they? They
Well, the
absolutely-
technologies keep getting smarter and smarter so that they're more expensive, unfortunately.
Yeah.
But
And-
it doesn't always mean they're the best.
Absolutely.
You know,
I
some
still have
people
my
can-
old workhorses that I've had, the IPL. I still think the one of the intense pulse line. Explain what IPL is,
Yeah,
because I
intense
still
pulse
think that's
light is a
yeah.
broadband light therapy. It works for both browns and reds on the skin, and
But you get a beautiful glow.
it has a nice complexion.
It's
and it
beautiful
gives
glow, right?
Beautiful glow.
You just it's still, to me, you could still bring 100 lasers, I still think, but if you do an IPL, you still
It's
you
true.
get the glow.
It's
Don't
true.
you think?
Yeah, it's true.
I agree. Yeah. Yeah.
So, like you were saying before, I think
Yeah.
the most important thing is to have somebody that's well trained, that understands your goals, but also understands the internal component to it as well, in terms of keeping the skin healthy and hydrated and all of that. And so, I really think it's a complex process, not
Because
just a
you
individualized
have to,
thing.
you've got it, and so we know that we've got collagenase, which is an enzyme that breaks down collagen. So that's the thing you want to avoid, and there's so many internal factors. You have about equal, or do you have more male and female?
I'm about 50-50 in my
I
practice.
think you're 50-50, I would say.
Yeah, I have a lot more males though than I think than most people in their practice.
That's why, because most people, that's the point I wanted to make, is most of the time, dermatologists are like 80-20, all female
Right.
preponderance. You have an
I have a
equal
lot more
50-50.
males.
Yeah, yeah. Listen, thank you so much. This is not the only time, by the way, you're going to come on the show.
I'm excited
Please,
to be
okay?
here. I'll come anytime.